This is a phase 2 trial of a PD-L1 inhibitor in patients who have neuroendocrine or aggressive variant prostate cancer. This term is a broad basket definition of patients who have either histologically confirmed small cell prostate cancer, either transformed or de novo, or who have phenotypically aggressive features such as low PSA, liver metastases, high LDH as defined by aggressive variant clinical characteristics, but without tissue diagnosis of small cell. These patients really have poor outcomes with traditional hormonal therapies. They are classified as really having androgen receptor indifferent metastatic hormone refractory prostate cancer. And so in the PICK study, we call it, this was a phase 2 study of Avelumab every 2 weeks. The purpose of the study was to define for the first time the activity of immunotherapy in this population with a PD-L1 inhibitor. And this trial enrolled 15 patients. It was a 2-stage efficacy design. In this poster, we describe both the safety and the efficacy. On the positive side, we had one patient who had a complete remission, and we describe his case report where this man was found to have a brain metastasis from prostate cancer, and his brain metastasis underwent next generation sequencing, and he was found to have microsatellite unstable or MSI high prostate cancer from an MSH2 mutation. He had progressed with MCRPC after abiraterone, and he enrolled on this study. He went into a complete remission, both by PSA that went to undetectable, but also by radiographic criteria where his disease to this day remains in remission. He's now been off therapy for over a year, including he's been able to stop androgen deprivation therapy with a maintained durable remission. So that was the most positive outcome possible that you could imagine for this trial. But unfortunately, he was the only patient to have such an outstanding outcome, which you might expect because MSI high disease is really a distinct disease that is immune therapy responsive. The other patients on this study generally did not have an objective response and had a very short time to radiographic progression and overall survival, with only 2 or 3 patients having more durable, stable disease. Overall, Avelumab was well tolerated. We did see some mild immune-mediated adverse events such as hepatitis and pericarditis that was reversible with steroids. In general, our plans for this approach has now been modified to being an exploration of combined immune therapy with chemotherapy. These patients typically have such rapidly progressive disease that the integration of platinum-based chemotherapy with immune checkpoint blockade is our next planned design, and we call that study the CHAMP study. And that study is set to open in mid-2021 here at Duke University and some of our partnering institutions within the Department of Defense Prostate Cancer Clinical Trial Consortium. So while this study overall was negative, we did have some success in some patients. We've learned greatly from this. We have planned correlative studies, and we're planning to build on this experience for looking at combined chemo immunotherapy in these patients with really aggressive disease.